Radiation therapy is a cancer treatment that is most well known to cause skin irritation or breakdown, similar to a bad sunburn. My name is Kelly and I am a physical therapist and I specialize in oncology, but also lymphedema and women's health. And in this video, I'm going to share what you can do during and after radiation therapy to help heal your skin fast and help avoid blistering and discoloration. This video is going to be included in a series of videos on radiation therapy and treatment for its side effects. So if that's something that interests you, you can subscribe and you can follow along by pressing the link up here for the full playlist. During radiation, the first thing you will likely notice is the skin color changes. Depending on your skin tone and the intensity of the radiation, you may start to notice your skin will turn a pink, red, or brown color. Some areas of your skin will likely get more irritated than others, and that's likely due to some areas being naturally more sensitive. For example, for those who've had radiation to the chest wall for breast or melanoma treatment, may likely notice that the armpit region is most likely to get red and irritated. Other areas that tend to get more irritated are areas that your clothing rubs on, such as bands or straps from a bra or a waistband from your pants. The friction from the articles of clothing is likely going to be a little bit more irritating, and that will make the skin a little bit more sensitive as well. Along with the skin color changes, you may also notice that your skin will be more sore or sensitive to touch. You may notice dryness or peeling or blistering, and you may also notice some swelling or edema from inflammation in that area. These symptoms do tend to accumulate, meaning you will likely notice them towards the end of your radiation or even the first week or two after you're done. During your radiation and even a couple weeks after your radiation therapy, you want to make sure that you're using a perfume and chemical-free moisturizer or cream. Most doctors will provide this for you, but if they don't, here are a couple options. Some of the most popular options that the women and men that I work with like the most are Vanicream, Aquaphor, and Eucerin. Other popular creams that are not drugstore brand are Bass Farms Triple Hydrating Cream or even coconut oil. Again, if you use something off of this list, just make sure that you don't have a lot of chemicals in it and that you also do a small test area to make sure that your skin doesn't get too irritated by it. You want to make sure that you're also doing stretches to help avoid radiation fibrosis of the skin. If you are unsure what that is, be sure to check out my video on radiation fibrosis and tissue tightness. I'll put a link for that down below, and also you can click up above. Radiation fibrosis is one of the most common long-term side effects from radiation therapy, and definitely the most common side effect that I treat in the clinic related to radiation therapy. Another thing that doctors are beginning to recommend for their patients based off some new research studies are the use of vitamin E and pentaxiphyllin for 6 months to a year and a half. However, I am hearing a lot of doctors just encourage their patients to try an off-the-shelf or topical vitamin E oil. Vitamin E oil is something that is used typically for scars or scar tissue to help keep a moisturized barrier over the top and allow for better healing with softening of the tissue. There are a lot of creams out there talking about breaking down scar tissue or softening skin. You want to make sure you always look for something with less ingredients and more focused on the vitamin E's or the oils. Always check with your provider first. I will put a couple links down below for the options that you can find online. Now, there are also a couple small studies coming out showing that silicone is even better than vitamin E to help soften the skin or soften the tissue with scarring. Silicone will come in a couple different forms. It will come either in a gel style or in a sheet style. And a lot of times people will use them interchangeably, using the gel for a couple days and then putting a sheet over the top for a few days. Similar to the vitamin E oil, the silicone is going to help keep a moisturized barrier over that scar tissue or that thickened fibrotic tissue. That'll help soften it so it lays flat, but also so you don't have any long-term thickening or tightness. As always, you want to make sure that you check with your doctor first, but I will put some links down below where you can find some natural vitamin E oil as well as the silicone gel and the sheets. So during radiation, you're going to do your moisturizing and make sure that you're maintaining your range of motion with your stretches. But after radiation, what's most important to focus on? Your skin may continue to worsen for a week or two after radiation therapy. You may go through a peeling stage, but after that, it will likely start to heal. You will want to continue using that moisturizer or cream after radiation, but remember the skin can be really fragile, so be sure that you're gentle when applying your lotion. Although the skin redness or discoloration will likely go away over time, this can typically take the longest to heal. If you notice a small tiny patch of blood vessels in the area that was radiated, this is called telangiectasia. Telangiectasia is not a reoccurrence of cancer, and these tiny little blood vessels are usually benign and they will go away on their own. Another really important thing to know after your radiation therapy is that it's critical to continue using sunscreen. Not only should you use this right after radiation, but you should also be using this long term. Try to find a zinc oxide based sunscreen that has a minimum SPF of 30. I like the Badger formula because it has options for tinted sunscreen as well as for those who have sensitive skin. If the skin damage is severe enough from radiation therapy, something like hyperbaric oxygen treatment may also be done. If your skin is still not healing and you are a smoker, you highly want to consider stopping smoking so that your skin can heal faster. The human body is pretty remarkable and it will heal over time. Using things like moisturizers, sunscreen, and avoiding any irritation to the area such as rubbing from your clothing or even chlorine from a pool, as well as avoiding lifestyle things such as smoking, can all really help speed up the recovery and healing process from radiation therapy. Always know that these videos are for generalized information only, so if you have specific needs, be sure to reach out to your doctor or your radiation team to help get individualized treatment. If you found this video helpful, please press the like button and I will see you all at the next video. Thanks everyone.